I went up to my local Aboriginal medical service in Toowoomba. I was living in Gatton, South East Queensland at the time, for my annual 715 check. It's the Deadly Choices check, right? And we mostly do it because we get a Deadly Choices t-shirt, right? So I went up, I did the test, so no worries, whatever, give me my t-shirt. And I took off back, and I was a prison officer at the time. So when I got a call a couple of days later, the auntie on reception said, "Here, my boy, the doctor wants to see you." And I'm like, "Why? I've got my t-shirt, don't worry, I'm good." No, the doctor really wants to see you. What for? I can't tell you. And so I started getting a little bit worried. Okay. So I went back a couple of days later and they said, "You've got type 2 diabetes." I thought, what? I'm a prison officer. I used to go to the gym regularly, lift heavy things. I was healthy. I was going, "Are you sure?" Yeah, no, we're positive. And the doctor said to me, the first doctor I went to said to me, "You've made some poor lifestyle choices. You now have this diabetes." And I was gutted. I was devastated. I was like, oh my God. Because in my family and my extended family, if you had diabetes, it was a death sentence, right? And a lot of older family members had gone to hospital because they had diabetes and they needed amputations or they needed other critical care assistance. So I went into denial. I was stressed as, and for a year and a half or 2 years, I was searching social media, which was the worst thing to do. And then with my 4 daughters, I said, no, look, I really need to learn more about this condition. So I met with a brother boy at the Musgrove Park Family Fun Day, NAIDOC Family Fun Day, and he sat me down and he said, no. Your diabetes is probably genetic. What? So I kind of started looking at more. I joined the state advocacy diabetes body. They gave me a whole heap of pamphlets with brochures and other things. They gave me a portion plate, which I still have, and I thought that was funny because none of the information meant anything to me as a First Nations person. And then I got involved in some online groups and I started becoming a little bit more vocal and passionate about diabetes in First Nations people. And I started discovering just how prevalent it was, right? And I started going, well, why is this so, And then I met another brother boy who's now working at the National Indigenous Genomics Project, Dr. Alex Brown, and he kind of said, no, you idiot. You probably developed it in utero. What? So Mum developed it when she had 10 kids and we adopted 4, and she more than likely had gestational diabetes. And it sat dormant in me until I started working in the prisons, and then I worked on the Royal Commission into Institutional Responses to Child Sexual Abuse. But that trauma triggered my diabetes. And it all started making sense. So I then went on to become a speaker on First Nations diabetes and just how poor the resources were. There was virtually no assistance. There was certainly no educational programs out there. And then I got employed by a national advocacy body, and that's how I came to Canberra. Social and emotional wellbeing for First Nations people is a whole of person, whole of country. It's not just around the physical and clinical aspects of my life. It's not around just my mental health. It's around, for me, it's around being on country. It's around taking time to sit and reflect, sit and listen to country. So I've mentioned I'm saltwater from Larrakia side and Garijari side, which is from just south of Broome. So for me, even though I haven't been on my own country for a number of years, I was lucky enough to visit. But we're lucky enough in Canberra that the ocean is 2.5, 3 hours drive from here. So I can go to the ocean, I can sit and listen and smell and feel and touch. And it does my spirit and my mental health so much good. For me also, having a yarn, and it's around finding somebody in your life who you can, just for 8 minutes, that's all you need, to ring and just have a yarn. So I had a brother boy, unfortunately he passed. And for nearly 12 years, we would just out of the blue ring each other up. Just stupid things, right? And although if he was feeling down, or if he was not traveling well, we would just talk. I would just sit and listen. And that was enough of an outlet to give you time to breathe, and you go, I'm not alone in this. And we'd have a laugh. And humour and laughter is huge for First Nations people. I love getting together with aunties and either getting one of them to growl me, but that means I'm in a relationship where she feels comfortable enough to growl me. She's teaching me. Or laugh. We have a big laugh. And that's a release valve. So that's very good for you, not only emotionally, spiritually and mentally, but it's culturally, it's good to be with a mob who have shared lived experience, who understand the journey that you've been on, because they've been on it too. And that again is that sense of, I belong. For me, some of the cultural activities that I undertake to manage my cultural and social and emotional well-being is most Friday nights I have a fire pit. So I live in a suburban complex, right? I've got a tiny little backyard, but I can fit a fire pit. And it's that opportunity to, no technology, we go out and we sit down and we look at the fire, we listen to the fire. On starry nights, it's beautiful to sit under that canopy of stars as much as you can in the town light of Canberra. And on full moons, it's beautiful to see that full moon rising, and talk to her about, things that we've done, things that impact on us. I am also trying to learn the Mamilama, which is the Larrakia word for didgeridoo. I'm terrible at it, but for me, it's like when Mum Nora taught me how to do the cross-hatching painting. It's an exercise that takes you away from the world. So playing the didge for me takes you away from everything, and it lets me focus on not only the technique, but also who I am as an Aboriginal person.